Our topic of conversation this evening is body contouring after significant weight loss. Our guest expert, who's here to answer your phone calls at any time throughout tonight's show, is Dr. John Mancall. I want to thank you so much for joining us tonight.
Thanks for having me.
Could you start us out by telling us how this type of surgery differs from perhaps what we discussed last month in regards to tummy tucks and liposuction for someone who's just looking to lose a little bit?
Sure. These, in my mind, are very different patients. They're undergoing very different operations. Although some of the terms might be the same, tummy tuck or breast lift, they bring to the table so much more skin as a rule, and sort of poor quality skin that's been stretched out so much that it doesn't behave normally, that the way you tailor the tissues is vastly different. The extent of potential complications, bleeding, collections of blood under the skin, risk of DVT are also much greater in these folks. And they bring to the table usually some chronic medical illnesses that have been around long enough where they may have some effects on their heart or lungs or kidneys that might impact their recovery or the amount of stress, the surgery that they can tolerate. So you do have to approach them in a vastly different way. In addition to that, I think expectations really become different at the end here. And again, part of my job, as you've heard me say before, is make sure I keep expectations in line with what's reasonable.
Now, when we're talking about the patients who are doing this type of surgery, is it generally after bariatric surgery, or is it, in some cases, people who have lost the weight on their own?
It could be either. I have a number of patients in my practice that just one day got fed up of feeling the way they do and looking the way they do, and they just kind of got committed to themselves and to making a better life for themselves, and they lost the weight, and they chugged along, and it may have taken them 2-3 years, a little bit longer perhaps than someone who had bypass, who may lose 100 pounds in the first year. These folks, it took longer, but they were motivated and they kept with it, and you know, I'm incredibly impressed with kind of the stick-to-itiveness that some of them bring to it.
In regards to people who make a good candidate for this type of surgery, what would the criteria be?
As I said, I think that really a realistic sort of expectation of what we can do for them. Some folks, no matter how hard you try, you're just not going to sort of take away all the extra skin and only leave them with a little scar from hip to hip. Sometimes the scars go all the way around, sometimes up and down. Sometimes, and I guess perhaps one of the other things is a lot of these surgeries become stage procedures. We can't do everything at one time, whereas I might be able to do a tummy tuck and a breast lift on someone who just has a little bit of skin problems. On these folks, the tummy tuck alone may be such a big operation, it could take 6-7 hours alone as opposed to 2, that's all we do. That's all that we do that's medically safe. And some of those folks we may be able to send home the same day, whereas these massive weight loss folks, we're keeping them overnight or a couple of days.
When we talk about staging the procedure, how long apart might the procedures be for the different body parts if we're talking about a significant weight loss with a lot of excess skin?
What I'll typically do is I'll kind of group operations together. For example, the excess skin around the stomach and the back and the thighs can be managed usually one time. And then you may say, okay, 2-3 months later, after you're sort of kind of recovered and everything, we might be able to approach the arms and the breasts, because a lot of the laxities in one area rolls into another, so to speak, and you can utilize some of that tissue. For example, when I have women with a lot of extra skin under their arms and kind of we call the flank area, kind of where the bra strap goes, sometimes you can actually take that and shift that and use that to augment the breast, because a lot of times their breasts are now flat and kind of empty, and you can use it to fill it up, and that can be kind of tackled at one time. Other times the inner thigh, for example, I can't do while I do the outer thigh, so that's something that may be done as a third procedure, maybe coupling that with the neck, for example, when people have a lot of extra skin here. A lot depends on what's the patient's expectations, what really bothers them, what is insurance going to pay for, and what are they going to have to pay for themselves. Those are all factors that we sort of look at. And then you sort of look at what kind of time do they have for recovery, and you can pick and choose the procedures based on that as well.
So if we're talking about a person who has lost significant weight and they're now stable in that weight, they're not
Correct.
intending to lose any more, at what point would you say, when you're in this process of thinking, I am dedicated or I am getting the bariatric surgery, either way I'm going to be losing this weight, how long ahead of time would you say you need to start planning perhaps for the body contouring, since, as we mentioned, some insurance companies do not cover this procedure for most instances?
I tell folks, let me see you right at the very beginning when you're meeting with your bariatric surgeon. If for nothing else, I think we can offer sort of a carrot for those folks, kind of incentive to say, hey, if we can get you to here, this is what we can do, and let's show you some folks who've been there. There are some folks I do take care of before they're at their ideal weight, because when that belly starts to get loose and hang down, they have such bad rashes, and it sort of goes down almost to their mid-thigh or sometimes further. They can't do exercise, or the rashes get so bad that they can't because of the raw skin. And I have a number of folks who I've sort of done an interim kind of procedure to get rid of that extra overhanging tissue, knowing that they still have more weight to go, but we're just trying to get it so they can keep on their exercise program. So not everybody will be taken care of only when all the weight's lost. A lot depends on sort of what the problems are.
Now, you've brought some dramatic photographs, I think, that really show the difference as to what you can do in regards to removing the excess skin and tightening things back up, and wanted to know if you wanted to go through some of those.
Let's take a look at those. This is just a schematic showing sort of the truncal area, just kind of identifying. If you look at sort of the orangey color, we see a lot of those sort of flank rolls, lower abdominal areas, outer thighs, the back, buttocks, thighs, and not shown on here is, in addition to the breasts, is the arms, the neck. Those are all areas at risk after you've lost a lot of weight. The next picture here shows a typical patient who's lost a bunch of weight. You sort of see this crepey skin. It's literally like crepe paper, very thinned out from being stretched for all those years, just roll after roll. Rashes develop in here. And we look at the next picture, it's sort of a compilation of before and after. Now this patient has a scar that goes side to side by the bikini line and then up and down from basically the base of the breast all the way down to the pubic area. Because you now, unlike a typical tummy tuck patient, you're really having to work in a lot of dimensions to tighten and get rid of that extra skin. And here's just a side view of it. And this is possible, but you know, it takes a lot of work for these folks to get here. The recovery is, 4 to 6 weeks sometimes. They really have to plan. They have to plan for getting themselves ready for surgery and having everything prepared afterwards. They need help at home. The risk of blood clots is significant in the sense that they can't just go and sit around. We'll even put some folks on Lovenox, kind of a blood thinner, for a few weeks till they're really moving on a regular basis.
What are some of the side effects? We're talking about some of the risks and side effects as well that people should be aware of in regards to getting surgeries of this nature.
Well, again, unlike sort of compared to the cosmetic tummy tuck that has a very low complication rate, I tell these folks there may be a 100% complication rate of a little wound breakdown, a little infection, blood collections under the skin called hematomas, fluid collections, soreness, pain. The risk of blood clots, as mentioned, is a little bit greater. And the fact that, your scars may not be small. Breathing is also, make sure they're taking good deep breaths afterwards. And nutrition's critical. I mean, the hardest part, I think, for a lot of folks that I see is they want to assume their hard days of nutrition and caring about things are over behind them. But truthfully, the statistics with bariatric surgery show, maybe a third of folks rebound because they haven't really kind of gotten onto the bandwagon or the philosophy that they have to modify their diet. They can stretch out their pouches. You can take a lot of calories with milkshakes. So you really have to make sure those folks understand psychologically the changes in their lifestyle, and then we can change the physical portion.
When we're talking about psychological profiles, perhaps, of somebody who would be successful with this type of procedure, are there certain things that physicians look at before approving a candidate?
I think we should. I can't speak for other folks, but I can speak for myself, is that I think a patient that can tell me more about their disease than I know is a motivated, educated patient. The people that know their medicines they're on, they know the supplements they're taking, they know how many calories they take on a daily basis, they know what their goal weight is. These are folks who have done their homework. These are folks I can count on to continue to do their homework and be vigilant. When I see a patient that comes in and I say, what medicine you taking, and say, I'm taking some for blood pressure, or what's your goal weight, and say, well, I don't know what my goal weight is. These are all things these folks should know. I mean, they should know more about their own health care than their doctors. And if they don't, they need to get educated on it, and I try and encourage them to do that. Because the only consistent patient at every office visit with all their doctors is them, and they can help their doctors take better care of them.